Think about us. Think about you.
What's going on, everybody? We are live on the Performance Medicine Show. As you can see, I've got an empty seat to my left, maybe your right. That means Andy is going to join us today on the show. Welcome in. We're going to let a few people get in here. I want to make sure we are live. I see Roel's in here. Roel, what's going on, man? Great to see you. I think we're gathering here. Tom, what's going on? My power lifter. How are you, brother? It's good to see you. We're going to let a few people come in. Welcome, welcome, welcome. Happy Tuesday. Happy Tuesday to all who celebrate. Nikki, what's going on Instagram? Polly, what's up? We're getting some people in here. Hello, Stan, what's going on? Great to see you. Let's see. We're going to keep letting some people pile in here. Welcome, everybody. Thank you all for hanging out with us tonight. As you know, we're going to be answering questions for the next hour. My brother, Andy, he's prepping. He's, doing his thing, getting ready for Qs. Cherry, what's up? Great to see you. Thank you all for hanging out. Let's see here. As y'all know, on Tuesdays, we send out Performance Weekly. Thank you guys to all who are signed up with Performance Weekly. We send out a weekly email every single Tuesday at 3. If you saw it, you saw this. And yeah, we're still trying to figure out the hat. We're trying to figure out the shirt. I've gotten a number of texts about this. That is a Tour de France hat. And that is a Bill Walton shirt. He was really in a mode here and talking about quercetin max. There's Andy. What's up, man?
That was a good picture of Dan. I like that. Can I say that I did get him that hat?
You did.
That was from me.
You can say that.
That was from me.
You can say that.
Then this isn't my side. That's okay.
But you're always on this side when we record.
I know. We might need to switch that, but there's not a door on that side.
Yes.
I can't come in late.
I'm kind of trapped.
We're not.
We're gonna start the recording here in just a second,
Okay.
Guys. This is just for y'all that are live with us.
Live. We got 17 in the count. Invite your friends. We're excited to have you.
If you're with the family, let us know.
Also, I know that mom is on the other side. I wasn't late. I was right over there. I see you. I see you looking. It's fine. I was actually deciding, as you know, has anybody commented on Ben's facial hair? We have dropped 10 years, ladies and gentlemen, with this facial hair. And I was deciding before coming here, maybe I should trim some stuff up. And I looked and I thought, I didn't want to spoil this moment for you. I didn't want to steal any spotlight.
Take away my shine.
I didn't want to take away. You are shiny. Look at this face. Youth at its best. Ben is taking the youth serum.
Thank you.
He's taking all the Dr. Rogers vitamins.
Well, I'll tell you one thing I am taking. That's quercetin max.
Quercetin. He is getting those flavonoids in. He is fighting infections.
You know what?
You know what, Ben? You're infectious.
We're doing this
Look at that personality.
Totally impromptu. Give your best commercial for the quercetin max. Dr. Rogers quercetin max.
Quercetin max. God, you want to max out with quercetin? Quercetin max by my dad. My daddy says to take quercetin. Quercetin is great. Like I think too that we underestimate the power of flavonoids, of naturals that can help with not only getting rid of free radicals but protecting you from infection. Plant-derived compounds. This also has N-acetylcysteine, NAC, and nettle extract. I don't know much about nettle extract, but NAC I do, and vitamin C. It's got 200 milligrams of vitamin C in it too.
What's interesting is the original quercetin video we did 3 years ago is still, it might be our top video of all time on the YouTube channel. So if you guys have not checked either one of those out, please do. One, especially for us, we're in East Tennessee. Allergies are a big deal here. I know Doc has taken it for that. Real quick, I want to give some shout outs. I see Carter's in here.
Hey, Carter, first off, thank you for saying that about my shirt. I just found this.
Yep. It
And I
looks
was like, I
awesome.
hope someone says something about my green shirt.
It looks awesome.
That means so much. Oh, Carter, my soul sister.
I see
Katie.
Katie's in here. Katie, what's going
Katie,
on?
my other soul sister too.
I love it. Soul
The
Sister
soul
1
sister,
and
the
2.
Giggly Soul Sisters.
I see Ivy's
love
in
it.
here. Ivy and JC with Ivy.
Just oh my gosh.
Ivy's
yes.
and JC with Ivy.
JC's and Ivy. Oh yes, guys, Ivy. Listen, Ivy and I are going to start dancing. Okay, Ivy's a dancer. I'm a dancer. We almost started tap dancing in the room. We did.
I see Barbara, Lisa, Amy. What's going
Amy's
on,
in the
guys?
house. It's
So
a
good to
pic.
see y'all.
This is Taylor.
Taylor's in here.
Oh no.
All right, guys.
Taylor.
What this means? Mics are up. We're getting ready to record.
Taylor. Taylor's in the house.
All right, now we're recording.
JC's in the house. Get that little,
We're
baby
recording.
out there.
Stacy, what's going on? Hello, hello.
Yes.
Great to see
We're
you.
so excited.
What we're gonna do, guys? We had only a couple questions come through.
Guys, we're keeping it short
email.
and simple today.
We're gonna go
We're
straight to
keeping it-
live.
We're going straight to live.
Straight to live.
We got only a couple questions, and that's okay.
That
Listen,
means
Short and sweet.
Well, real quick, if y'all have a question for Andy, go ahead and put it in the comments. Thank you guys for joining us. If you're just now joining us, I'm going to put this up because Margot did an unbelievable job in this episode explaining
did.
this, just talking about partial gut reconstruction. That's a cool thumbnail.
That's a great thumbnail. What is happening to that head of hair? Oh
That's
my
some
God,
hair.
I got to see my new stylist.
That's some hair.
That's some hair. But yes, Margot did. I loved doing that with her. I actually did that with what we talked about. I did with the patient in the room a day or two after we talked about that.
Can you explain partial gut reconstruction real quick?
I made that term up. That was
Did you
something
really?
I made. That is not an official term.
Okay.
Do not take that to medical schools or PA schools. It's
That was
not
very
official.
creative.
I made it up.
Straight
Yeah,
to
I thought it's so Margot and Robin especially, they're very thorough with what we want to do with cleaning out the gut, with rebuilding our immunity. They're both gluten-free peeps. They've been gluten-free forever. And so to really do it, you got to clean it out. You got to know exactly what's in there. You got to clean everything out, both with prescriptive and natural remedies. You got to rebuild, and you got to really go on a strict nutrition plan. And I didn't want to do that. So I thought, you know what? I've had people that don't want to do everything that involves a gut clean out. So we kind of came up with what a partial reconstruction looks like. What are the things out of everything that you could do for the gut and what's feasible right now, and see how symptoms relieve?
I think that's super kind of relieving. Like you don't have to,
Because
because
being consistent, you'd be proud.
I
can stick with this plan. So
Yeah.
I'm doing
I love that.
BPC 157 oral. I'm doing L-glutamine powder, and I'm doing a strict gluten-free.
I love it.
Aside from last night.
A huge shout out to
Don't know.
Margot Kosturian for doing that video. Thank you so much. She's in our North Knoxville office where we're at right now.
We're overlooking
We're overlooking
the city of
Fountain City.
Fountain.
I see my brother Steve's in here. Steve, what's going on from
Steve,
Digest Shield? We
nicest
love you.
guy ever.
We love you. Can't wait. We're going to record with Steve on Friday, I believe. I'm super excited about that.
And Digest Shield's part of my gut reconstruction. Yes.
Yeah.
Sorry,
Part of-
Steve. How could I forget?
It's a part
The
of
shield.
part.
That's part of my partial gut reconstruction. I do the Digest Shield with everything I eat.
All right. I see Lynn K. Lynn is in here. Thank you, Lynn K. Lynn. I see your question. Jack, what's going on, brother? Stacy, I see your question. Thank you. All right, y'all. If you have a question for Andy, Linda, hello. What's going on, Linda?
Linda's in.
You got a question?
Linda, I've been to Crumb Bum. I haven't seen you. Last time I was there, I thought I saw you outside of Crumb Bum.
I'm gonna go to Crumb Bum on Thursday. You can almost guarantee it.
I don't think I can eat anything at Crumb Bum anymore.
Probably
God,
can actually.
It's a tough day. Just coffee.
All
Just water.
right, we're gonna go ahead and start with a couple questions. If you guys got a question for Andy, go ahead and put it in the comments.
Put them in.
This one is a really great question. Thank you in advance for sending this in over email. I'm having a magnesium RBC test, and the instructions say refrain from taking vitamins or mineral herbal supplements for at least 1 week before sample collection. Please explain why it's necessary to stop all vitamins just for a magnesium test. Common question we get around is like, how do you test for magnesium? It's the RBC.
Right. Okay. So it's a little bit different. Yes. So necessary, not necessary. I think that is what they say on all those. They're going to say stop your vitamins for at least 1 day to up to a week to make sure that it doesn't interfere with the test. That's really with a lot of tests because a lot of different vitamins have different things in them. I think that's honestly a safeguard to say that if your multivitamin has biotin in it or some sort of vitamin UN has calcium in it, both of those can really affect testing. I think honestly that's a safeguard, but magnesium RBC testing is a little bit different than just a magnesium draw that you would get in a metabolic panel. It's not testing for the serum levels, it's testing for what's inside the red blood cell. So basically, that magnesium can be pulled from the serum into the red blood cell and can affect what the testing looks like. So the RBC is a little bit more accurate. I would say I wouldn't worry about it too much if you're not having symptoms. But if you really want to know, I want to know exactly what my level is without supplementation, I would stop every supplementation you have for a week. That's going to be the most accurate way. None of the other supplements and vitamins that you're taking and minerals are going to affect what goes intra and extracellular, and you'll see what's actually inside the red blood cell. So it depends on what you really want. If you just are like, I'm just curious to be curious, then I'd say don't worry about it and just don't take magnesium. Or you can take magnesium and see kind of what you're responding to with supplementation. But RBC is what's being pulled into the red blood cell, not serum. So it's a little bit more accurate and it's a different process.
Who would want to check an RBC? Because there's like 8 different magnesiums you could take. Who would want to check for this? So
I would say if you're really curious, there's 2 things. One, magnesium RBC is really good for high creatinine levels. So if you're a chronic bodybuilder, if you do a lot of protein and you kind of get wonky kidney function, magnesium RBC is a good one to check. Second one, if you're on magnesium and you're just curious, that's another good one. Or 2, if you're symptomatic, low magnesium, seizure activities, really, really intense cramping, restless leg syndrome that keeps you up at night, some cardiac symptoms too. Magnesium is super important for cardiac rhythm. So I say cardiac, seizures, cramps, restless leg.
Such a great question.
That's a good one.
Yeah.
So I hope that's a little bit of a piecemeal answer, but it's more of like if you really want to know, stop everything, because there's something in some of those vitamins that can interfere with what that magnesium is really going to look like. If you're just curious for curiosity's sake and you want to know if magnesium's doing what it's doing, then you don't have to stop it.
I feel like there's not a lot of tests that you would have to completely cut out everything for a week. I feel like that's not common.
I think it's a safeguard. It's like if we tell everybody to not smoke anywhere, you're probably going to smoke outside, but not inside a building.
Sure.
That's a weird analogy, but do you know what I'm saying? Like if you really blanket it and be like, actually stop everything, you're more than likely going to stop most of it. And you're not going to have something with magnesium in it or biotin or calcium, which really do affect levels. So that's more of a safeguard.
All right. Thank you, Ange, for that answer. We're going to keep moving
That's
here.
a good one.
Please explain why the Fortibone collagen is better for bone health than a standard collagen. I have switched to Fortibone in hopes that it will help my bone density, but I don't really understand why it could help more than the collagen I've taken for years. We get a lot of collagen questions on the show. I love this question. I have no clue what Fortibone collagen is, though.
So collagen's good for you. Collagen specifically collagen can help with skin.
Did you just get some?
Did I just get collagen?
No, yeah.
L-glutamine.
Glutamine. Okay.
It's glutamine.
You got a package in
but it looked like collagen.
It looked like collagen.
It did look like collagen, but no, L-glutamine.
Okay.
I think. Yeah, it was L-glutamine. We'll ask Mark.
And protein. You got some protein too.
I'm on the protein kick.
Yeah.
Ladies and gentlemen, we're trying to build. Ben and I redid our embodies, and
there's mine right there.
Yep.
It's gotten
worse
worse.
right there. It's a little less burgers and fries for this guy. No. So collagen can actually help with the bone matrix. So when we're looking at supplementation for bones and osteoporosis or osteopenia, which means decreased bone density, so the bone matrix and all the stuff that builds bones like osteoblasts, all deal with collagen, calcium, vitamin D, and estrogen. There's a lot that goes into the building of a bone, but collagen's a big part of it. Fortibone collagen, to my knowledge, Fortibone collagen, the reason people like that is because it's backed by research, is what I found. So it's actually got a study associated with it that actually showed improvement in bone mass density. In BMD, that was with T&Z scores, DEXA scans in the spine. So that's, excuse me, that's really what they're finding with that Fortibone collagen. They're saying that it's also bioactive. So it's actually living, and it actually works a little bit better on cellular activity. That's what they're proposing why it's better. So there is a study associated with it. I believe it has over 130 people in it, menopausal women, that showed that it had an improvement in BMD in the spine.
Interesting.
So I think that's why. But two, it doesn't mean that the collagen you've been taking might not be a good collagen too. I would say two, a good way to test is to continue doing DEXA scans. To also take calcium's kind of like hit or miss about whether or not people like it. We have lots of videos. Jill has a great video. She's our osteoporosis or osteopenia specialist on calcium.
Yep.
In addition to just like bone health in general. So check out that one for calcium, but vitamin D and estrogen are also going to be your best friends for that. Collagen is just really great for your skin too. It's for skin elasticity. High and tight. We keep it high and tight.
It is interesting. When I think collagen, I do think skin.
Yeah. But it's great for the bone matrix. It can actually stimulate osteoblasts to do what they need to do, which is build bones.
Interesting.
And people do review like hair, skin, and nails. Nail integrity will get better with a certain type of collagen. So I'd say two, the collagen's working if your hair is growing and your nails are growing.
Interesting.
I notice it too when I'm on those collagen gummies, which just taste amazing. My nails will grow better. Like Wolverine.
It's so interesting. When I was talking with Brittany about fungal toenails, this was last week, I believe.
Yeah.
And it was interesting how important nails are. And they're just kind of there. But they're pretty important.
They're protective measures.
Yeah.
They're absolutely protective measures, signs of nutrients, a sign of autoimmunity. You can actually tell a lot by the nail beds.
I was asking her just
oxygenation. God, yeah.
It's like you have a fungal toenail, and I'm like, why does it matter? If it's not bothering you, is it just aesthetic? But it actually does matter, and it is pretty telling.
They can see an infection. It's anything too that's protecting you from the outside world to get in. Nails are part of that.
Oh yeah,
absolutely. And two, it's part of survival too.
I see Connie Lynn's in here. She agrees.
Connie Lynn.
Best collagen to take. I'm assuming
if
she's
Connie says
agreeing.
it's a yes.
Yeah, so
I'm just going to tell you right now, if Connie says that, it's a yes.
Connie Lynn, thank you so much. That's
She's
awesome.
living proof.
All right, guys. We only got 2 questions that came in throughout the week, so that means we are spending the rest of the time with you guys live.
I think the third question is where you're going to get more sweaters when the circus runs out of town.
That's a Santa Claus quote.
The Rogers family, we love to quote Christmas movies.
Christmas movies, even in August.
Mean Girls, Barbie, Christmas movies, all
love
the
it.
above, Family Stone, Santa Claus. We got you covered. 4 Christmases.
I see positive vibes. Got a question there on Instagram.
Flip the tube. Flip the tube.
We're also taking movie questions tonight.
Ask us anything.
All right, let's go here. Let's rock on, guys. We appreciate y'all being with us live each and every Tuesday. If you got a question for Andy, go ahead and put it in the comments. Tom, we're going to get you on the email list. It comes every Tuesday. We'll get you on there. Let's see. Let's go to Stacy. Stacy, thank you for being with us. How often do women need a testosterone 25 shot?
Stacy, you're the bomb. You're the bomb. I have to say that first. You know it. You know it. I know it. It's all good. Okay. It's all good. You're the bomb. How often? Okay. So 2, technically how we start with female testosterone injections at 25 milligrams or 0.1 milliliters is every 2 weeks. So we start there. The duration of action is technically 10 days, but testosterone in females is very potent, especially when you get it into an intramuscular route of administration or even subcutaneous. So that tends to have a little bit of a tail for women. I've checked a lot of testosterone on women who are on injections this week, and you get some really high results. So we start with 25 milligrams every 2 weeks, but you can technically do it every week. I wouldn't do it any sooner than every week. And you can do 25 milligrams every week. I actually changed someone today to 25 milligrams every week because the 2-week response was not really what we wanted and she wasn't feeling it. So we're not overdoing it. When you're looking at testosterone, you look at it very similarly that you do to men, that you don't want it to increase the hemoglobin hematocrit too much. So checking a CBC and checking your testosterone value at peak, I think is good. So that's very dependent on the female. I've had some women that do T 25 milligrams every 2 weeks and their T's in the hundreds and they feel amazing. I've had women who don't, and they switch to 25 milligrams once a week and they feel amazing, or they do something in between, like 15 milligrams, 25 or 20 milligrams. That's a good question. So that's very dependent on the person.
You know, what's interesting is one of the things we hear a lot in office is how good women feel on testosterone,
Oh,
but you can get the levels too high, right? So you have to
can.
kind of manage that.
you can. And honestly, what I'm learning, I've had a lot of women with, I've had a few that have been high, like kind of raise your eyebrows high,
Mhm.
and they don't have symptoms. They don't have side
It's not
effects
like
that
a
you would
bad
think.
thing.
They're not growing beards. They're not having vocal changes. I've had it happen once over 5 years, but and dad's maybe had it once or twice. But I think there's a lot more wiggle room than we give it credit for. I think a lot of it too is how sustained that high level is. So the higher you run the T, the more your body gets used to that higher level of T, and you can become normalized to it. And the more T, you don't want too much T. Too much T on a female can be a little bit harsh.
Yeah.
It can be harsh on your arteries. It can be harsh on the blood counts. Maybe even harsh on the bones. It's not like documented, but it's stimulating red blood cells from the bone marrow. So it has it's got a signal pathway there. So I'd say you don't want it for too long, but anywhere where you're peaking in the 100s, 200s is good without side effects.
Stacey, great question. Thank you that's such a practical
That's a great
question.
one. That's a great one.
Yeah, thank you so much. Let's move to Instagram. Positive vibes. One, I just love positive vibes.
We love positive vibes.
Thank you for being here.
We're positive vibes only.
I love it. I love it.
We don't do negative vibes.
The question is HCG and Clomid counterproductive for fertility when used together? Great question. You know, we hear a lot about, or at least I've heard Dr. Rogers talk a lot about HCG and Clomid in regards to fertility in men when they're trying to get on testosterone replacement, where they want to boost their T but not decrease their ability to have kids.
Correct.
Okay.
Correct. So too, these would be kind of in the gonadotropin releasing hormone class, or agonist, GnRH agonist. So there's a pathway within the brain and the pituitary, this little dengue ball that has all the hormones in it, where one will stimulate another, which will stimulate another. GnRH will release the gonadotropins, which is all of your hormones. So when you're thinking about it for men, GnRH will then go and stimulate spermatogenesis in the testicles, which then increases your testosterone. So Clomid and HCG both do that. I don't think they're counterproductive at all. No, so they're not going to just interfere with each other where they're competing for the same source and not having the intended effect. I do think it's too much. I don't think you need both. And that's going to be very dosing dependent, because I have some guys that respond very well to Clomid, some guys that respond well to HCG. Maxing out on either is going to be HCG, usually 50 units, depending on the formula, like the milliliters, twice a week. Clomid, you can actually go higher than that during active fertility stages. Clomid is going to be 25 to 50 milligrams once a day. I wouldn't do both of them at the same time, and it depends on what you're doing it for. So one is if you're doing it with testosterone, you just want to have a little bit in if you're just trying to save it. Save your fertility range, or two, to save testicular atrophy. If you're not stimulating the testicles, they can actually shrink in size. So that's what a lot of men use in conjunction with testosterone. When you're in active fertility stages, technically you want to be off testosterone for up to a full year before start. I mean, you can actively start and try during that time, but it can take a real whole year for your body to rebuild its ability for the brain to talk to the testicles. We have unbelievable videos on this too from Robin. So Robin is our functional fertility specialist. So I think she's got great information on that if you're looking for something more specific to your regimen, which we might have a little bit more.
1,500 units HCG 3 times a week, 50 milligrams Clomid, trying to get pregnant is what's happening.
Got it. Okay. So two
came off TRT.
Yeah. So I think that's absolutely fine. And I would too probably do some sperm analysis with that too. Yeah. There's also some functional things that you can do that will help out with the DNA of the sperm. So sperm can actually be shaped differently. So it's not just like count and is it there? It's how modal it is, and is it shaped the way that it needs to be shaped. So there's actually different things that you can do that aren't like endocrine disruptors that will get in there and help out with the shape of the sperm. Some of it too can be like heavy metal exposure. So sometimes getting rid of heavy metals can help out with that too. That seems like a very fair assessment. I would too do that in conjunction with sperm analysis to see what improvements might look like.
Positive Vibes. We did a
And give it
video.
time.
Yeah. If you search sperm DNA Robin Riddle, that video will come up. It's
That's
super
a good
informative. It kind of encompasses all of this, what Andy's talking about.
Yeah.
I hope that helps.
That doesn't seem too much from
Yeah.
what, literally, that does not seem too much from what you're doing.
I see April just joined us. April, what's going on? It's so good to see you.
April.
We had such a good time
April.
yesterday. She was with us in North Knox
She
yesterday.
is. She's
It was
spent
so
some
much
time
fun.
with us. We've I want to say I wasn't part of the building process of our break room table,
You weren't. I wasn't
but I
either.
went upstairs to see what it looked
Can
like.
we give Eric a shout out?
Eric a shout out?
Eric a
too.
shout out. Margot a shout out. They
Margot
did
a shout
amazing.
out.
They did amazing.
April and Katie picked it out.
Yeah.
So we have a lot of people on that team for that break table. Okay. We're breaking together. We're breaking bread together.
I love
You're
it.
here to hear first, ladies and gentlemen.
April, thank you for being with us after
After
day
a
of
long
work.
day.
Yeah,
I
thank you.
know.
Thank you. Thank you.
Y'all.
Lynn K. Let's get to Lynn K.
Okay.
Lynn K. Lynn, what a parasite cleanse once a year? Any ideas just for health? So
I'm all about it.
you and I have talked about this.
Clean them. Get them out. Okay, get them out. No one wants parasites.
I think the phrase you use is
Everybody's got worms.
kill it, then drag it out. Not drag it out.
Well, okay, what's like binding?
Binding.
Binding, like that's what a parasite cleanse do.
Bind.
I think a parasite cleanse is great to do and also kind of correlate it with symptoms. Do you feel clearer of mind, better cognitive function, sleep, pain, like joint pain? Parasites can cause some weirdo stuff. Technically, people will do it with the full moon. Like if you think about it, like a parasite, like if you're going to treat your dog for ticks, fleas, worms, that's once a month. So I think I wouldn't go any more than once a month for a parasite cleanse, or if you're doing this comprehensive program that we do through Cellcore, which we do here out of North Knox via Telemed with Margot. That's like a 4-month program or a 9-month program. You don't want to just continually be on a parasite cleanse. Some things we were meant to live with and some things we aren't meant to live with. So I think doing it a couple times a year is great. Doing it around the full moon cycle, whenever the parasites are hatching eggs, that's when you're going to get the most benefit from it. Correlate it too with symptoms of how you feel. I would say once a year, yeah, maybe 2 to 3 times a year. Quarterly.
Interesting. Super interesting.
That's a great one.
Is it, out of curiosity, you guys talked about the partial gut reconstruction.
Mhm.
Could you do like a partial parasite cleanse, or do you have to go full on like a keto diet? You have to like.
No, I think you could just do the naturals that target, kill, bind, and pull.
Got it.
Absolutely.
Lynn K. Lynn, I hope
That's
that
a great
helps.
one.
Great question. We're going to keep moving here to Anna on Facebook. Anna,
Anna
what's up?
Law.
It's so good to see you.
Anna Laws. I got to see her the other week. which
That's
is great.
amazing.
Yes.
Anna, thank you for being with us.
And not
tonight.
outside Target.
That's awesome.
TJ Maxx.
Let's go. Let's see. I had colon resection surgery in January, battled diverticulitis for years, and has now gone into diverted. How do you pronounce that? Diverticulosis. I know digestion
is
is
spelling bee.
I know digestion is needed. What other tips?
Ben, you're doing great.
That's
You're
a
doing
big.
great.
That's a big word.
That's a big word.
That's a big
okay?
word.
Ben in the 5th grade won the spelling bee. Did you?
No, I don't.
Oh, okay. He wasn't there.
That's
Ladies and gentlemen,
not
I
real.
think that was me. I'm just kidding. I definitely did not. But I was in a show about a spelling bee. It was
awesome.
a great show.
Yeah,
It was a
actually
great show.
featured some stars, including yourself.
Like actuals, like, and they're
Yeah.
like on Broadway right now, which is crazy.
Super cool.
So cool. Anyways, okay, we digress. Anna, I'm sorry, we digress. You know me. Okay, colon resection. So colon resection surgery, for people who don't know, it's a partial resection. So they take out a part of the colon that has some sort of disease state to it. Sometimes they take it out for colon cancers, for polyps. Usually they do polypectomies if they're easy to grab during a colonoscopy, which is a view of your colon. Diverticulitis. Itis is inflammation. Diverticula is little pockets. So literally it's just like pockets. Diverticulosis is pockets within the colon. So diverticulosis can be in the colon. It can be in the esophagus. The hard part about it is that things can get stuck in there. That's what the hard part about diverticulosis. Things can get stuck in there, and if they sit there for a while, they can become infected, which causes diverticulitis. Very symptomatic. Bloody stools, left lower quadrant pain. That's kind of the diagnoses we're looking at here. So technically, DigestShield's great. So DigestShield is good at Steve, right? Oh, yes. Digest Shield has pre and probiotics. So you're feeding the good gut bacteria and putting in good gut bacteria, and it has enzymes to help you break down food. So that's going to help things move the way you want it. What other tips? You want things to move. So you want to make sure you're having good, even, clear bowel movements, and that things are actually, you're having good evacuation. So you're wanting to make sure that actually during diverticulosis, you have good fiber. Diverticulitis, you don't want good fiber. It's actually very different. And I'm going to triple check that. But one is that you do want fiber. The other one is that you don't. There's actually diverticulitis diets and diverticulosis diets. Fiber within diverticulosis is to make sure that things get compacted and move. And then you don't want that during diverticulitis. You want something very bland during diverticulitis to not exacerbate the infection. So it's actually, I would say, fiber is good, some sort of fiber. There's insoluble fiber and soluble fibers. I would look between the two of those and see what you can incorporate. Plenty of water. Good God, like technically you're supposed to get half of your body weight in water at the minimum in liters. Did you know that?
No, but that's a lot.
Half of your weight in liters, in milliliters. Half in ounces. Ounces. Jeez, that would
Yeah,
be
it
a
could be
lot.
in liters. Yeah.
Ounces.
Yeah.
So you're supposed to get half your body weight in water in ounces minimum. Technically, you can be 1 for 1. Right now, I've been on a water kick. It's been awful.
Like, do you feel better or
I
worse?
feel amazing. I feel amazing, and it sucks. It does. It's so much water. It's so much water. I'm doing about like the team in Johnson City got me a Stanley. Thank you, Johnson City team.
Yep.
And I drink out of it all the time. I don't
You
miss
did?
my Stanley. Me and all the middle schools girls out there. Me and all the middle schoolers are loving Stanleys and Uggs. I get about 1.5 gallons a day.
God, that's good.
It's a lot though. So too, a lot of people do 2 gallons a day. Water helps things move, and also too, Anna, move. If you're going to eat, move after you eat. Absolutely. People do like lymphatic flow movements and exercises after they eat, but getting out and walking, that's why, you walk the dog to make them go to the bathroom. We're the same way. We weren't meant to be sedentary whenever we eat. So I would say move, get things that help you move, which is going to be water, fiber, magnesium. Digest Shield's amazing. Then too, you can really go into a more like partial gut reconstruction with Margot. You can look and see what's actually in your gut with a GI map. So I'd say if you want to get into the weeds and into the details, that is a case where you absolutely can do it. But those are just like little things that you can do right now.
And I hope that helps. Thank you so much for putting that question
That's
in here.
great.
One, I'm going to put this up because I need a little encouragement. So
Ben is killing it.
I'm putting this up for me. Thank you,
You
Carter.
are.
Thank
Ben,
you.
you are. You are. Yes. Yes.
Your
Our pronunciations are amazing.
I'm going to put this one. This was in our weekly email today. Huge shout out to Digest Shield and Shield Nutraceuticals. Digest Shield contains 5 prebiotics, 11 probiotics, and 20 enzymes that address dietary discomfort caused by what you eat. You can see there a lovely pic from Doc. Thank you so much to everyone over at Digest Shield
Look
and
at
Shield
that picture.
Nutraceuticals.
Katie sent me a picture we have a new thing coming out.
I love
That's
it.
going to
I'm
have Dad's
excited.
picture on it. Katie sent us that picture. I was like, Dad's on the modeling career.
He looks great.
He looks
He
fantastic.
looks fantastic. Okay, let's keep moving, guys. If you got a question for Andy, go ahead and put it in the comments. Let's get to Steve here. My brother Steve, thank you so much. I have a friend who is diagnosed with microscopic colitis. Are there alternative therapies? He has got to go 15 times a day. He is suffering. We've done a video on microscopic colitis.
It's
There
tough.
are some binders out there.
Yeah, binders can help too. So fulvic acid's one binder. Humid, there's one that starts with a C. It's either, I think it's humid. It starts with HEU. There's another one with an H and fulvic acid that are good for binders to get things out. God, that's a tough one.
Yeah.
Alternative theories, I would say go on oral budesonide. Oral budesonide is not alternative. That is prescription, but that is horrific to go 15 times a day.
Yeah.
Budesonide can at least calm it down for right now. So I've had 2 patients with what I would suspect would be microscopic colitis. It wasn't confirmed on CT. We didn't do a CT. We wanted to try what the treatments for it looked like. Oral budesonide worked wonders for her. And 2, even looking at some antibiotics that were specific to a particular type of bacteria. So even looking at a GI map, if you can get kind of a stool test that can see what type of infection's in there, and doing kind of a full gut clean out would help out. So I would say anything too that's going to be gut healing. BPC 157 oral is a gut healer for the lining of the gut. L-glutamine is actually really great for gut lining, which is good. But I would say for him, oral budesonide, I would calm it down first and then work on alternative therapy. I hate that for him.
Yeah, shoot, Steve. I hope that helps. Please pass that along. Real quick, I want to give a shout out to some people on Instagram. I see Kaylee Bugs in here, Quilter's Friend 2, and Kathy Marsh. Kathy, what's going on? Great to see you guys over there. Thank you guys for hanging out.
It's a good group.
All right, let's keep going here. Let's get to where are we at? We're at Roel. Roel, thank you for being here as always. Then I know I'm missing a few. I'm sorry, golly, I'm like, shoot, I messed that up. Sorry. Let's get to Roel here. Andy, my sister-in-law and got the well, you know what? Got it. Okay. Message received, Roel. Now she had.
God, I was like, wait, maybe I don't.
Now she always has a bad cough. Could it be long COVID? Would you recommend quercetin max to help her? She has been having trouble breathing, and I believe they're okay. Okay, and I hope am I saying that right, Roel? And we'll. I think so. The question is, will quercetin max help with something like long COVID, having trouble breathing?
Well, I'm sorry.
Yeah.
Yes, yeah. I do know what. And yes, bad cough, anything systemic can come from that of having like long-term pulmonary function. And a lot of that is just the inflammation that kind of sets in, especially with something that's invasive. Your body tends to freak out a little bit. And some people it sticks in the lungs. Some people it sticks in the nervous system. So that's that taste and smell, cognitive dysfunction, memory loss. It could be long COVID for sure. Quercetin max is amazing. Yes, it can actually help get rid of free radicals. It works as a flavonoid to release and decrease inflammation. She's been having trouble breathing. So a lot of it too is I would look at the long haulers protocol. You can find that online with the frontline doctors. Quercetin is part of the long haulers protocol. Manuka honey, vitamin D in crazy amounts, actually doing rounds of ivermectin, looking at doing low dose naltrexone. I love low dose naltrexone, one of my favorites. So I think that those would work well. If I were in her position, I would look at the long haulers protocol and I would do all of it. And two, even that includes doing some steroids. If she's open to doing steroids, might help her breathe and just relieve some of the inflammation as she works on the alternative therapies to bring down the long-term inflammation. The best thing for long COVID, in my opinion, is low dose naltrexone. So, but quercetin max is a great start for that. So yes, but there's a whole list. We have some printed out in our office, but you can Google it right now about what's on that.
Roel, we're thinking about your sister-in-law. Thank you so much for putting that in there. I'm going to put this up for Steve. He asked for a spelling. So there is oral budesonide.
Oral budesonide. Yep. I believe it's 1 milligram a day for a month.
Okay. All right, Steve. I hope that helps a little bit. Katie's saying methylene blue with the long COVID.
Blue, yes, absolutely.
Yeah. Carter's saying immune complex from Dr. Rogers.
Amazing.
I love it. Thank you, guys.
Both of those are good too. Methylene blue is going to help out with if you get the electron transport chain in the powerhouse of the cell blocked up, which is what inflammation and severe infection can do. Methylene blue can help relieve that. And our immune complex has a lot of those naturals that are included in the frontline doctors, just all in one. So yeah, any of those.
All right, let's go to Coal Miner's Daughter. Coal Miner's Daughter, what's going on? Suggestions for vitamins of lifestyle changes for someone newly diagnosed with lupus who is waiting on specialist appointment. Any recommendations for Tri-City specialists? So interesting. I think we talked to, was it the Avise test person? So that's around lupus, isn't it?
Yeah, absolutely. So too, we actually do, God, I hate that. Lupus is a rough one.
Yeah.
Autoimmune disease, it can be very multi-system and inflammatory and waxes and wanes. It comes in flares, like lupus flares. Anything can trigger it. Stressors can trigger a lupus flare, and people have different symptoms from aphasia, not being able to talk. They have inability to move and function. People have difficulty too with pain. Sometimes not being able to see. Lupus is actually pretty rough and different for everybody. People can have skin manifestations with lupus as well. My favorite is low dose naltrexone. LDN's amazing. So that's going to be very proactive on toll-like receptors and interleukins associated with autoimmunity. So LDN's great. It's just not a vitamin. It's a prescription. But anything that's going to work like an immune modulator. So when you look up immune modulators, I brought this up in previous talks. In immune modulators, you're looking at decreasing interleukins. And different immune modulators focus on interleukin 6, interleukin 27, interleukin 18. They target different ones. You can Google which vitamins actually target those same things. Lutein's one, quercetin's one, NAC might be one too. So they all deal with, they can actually decrease the interleukins. So for her, she's trying to decrease the inflammatory response, specifically interleukins. I'd look at flavonoid class. Recommendations for Tri-City specialists. We have a great rheumatology team in Kingsport. That's usually who we refer to. I know they have like specific wait times too for that. But even just trying out here, like trying out with us, I mean, not just to self-promote, but low-dose naltrexone may be amazing for her. So looking at nutritional changes too with lupus. Margot is our advised and autoimmune specialist, so she can draw some labs that are actually more specific to lupus than just double-stranded DNA, anti-Ro, anti-LA. So low-dose naltrexone is what I would look at for prescription, and that's something easily to try before going to a specialist. I hate that. I'm sorry that she's dealing with that.
Thank you, coal miner's daughter, for sending that question in. I hope that helps a little bit.
Look up the interleukins and the naturals that target them.
Let's see here. We're going to keep moving, guys. If y'all have a question for Andy, go ahead and put it in the comments. Real quick, great little boost there for Digestial. Thank you, Ryan. I started taking Digestial 2 weeks ago, and it changed my daily life. Thank you, Ryan, for putting that in there. You shout out to Digestial tonight. Let's get to where am I at? Sorry, guys. Let's get to Lynn K. And if I'm missing you, I promise I'll make up for it. The question is, aren't DEXA scans a big radiation hit or not? Never had one, so it's around DEXA. That's interesting, actually. I've never thought about it from a radiation standpoint.
It's not a big hit. It's similar to an X-ray.
Okay.
So it's similar to an X-ray. Now you're not wanting to get a DEXA every day, but that's the similarity to it. So you're looking at pretty low radiation risk with a pretty high reward. So whenever you're looking at radiation, CT, MRI, X-ray, ultrasound, any sort of imaging, you're looking at what's kind of the effect for radiation. Yeah, and you can have too much radiation if you do too much imaging. The higher up you go, ultrasound, X-ray and DEXA kind of in a similar place, CT, MRI, PET, you're kind of going up that way. So this is a low radiation risk. No. And I think all women, I don't know when the actual age, it might be above 45, it might be above 50, should get a DEXA scan. They're easy. It's an X-ray of your hip.
Okay. Thank you, Lynn K. Lynn, I hope that helps a little bit. We're going to go. I want to put this up from One Step Forward. This is a comment on last week. We talked a lot about staying asleep throughout the night. So this is a suggestion, something that's working for One Step Forward. From last week, I didn't get to listen live. I had trouble staying asleep, waking several times during the night. Started drinking 1/3 cup of 100% tart cherry juice and using mouth tape. It works. That's incredible.
That's awesome.
Thank you, One Step Forward.
Yes, thank you.
There are, I think it's called like a Sleepy Girl mocktail. I'm a fan.
Yes.
I put a little magnesium in the tart juice as well.
Yeah, tart juice is amazing.
I'm going to put this up from Kay and then get to a question. Man, it's hard to pick one. What's your thoughts on this for Kay?
God, that's great. That's a great question. So this is a great question in general of how performance medicine works. So I'm actually glad you brought this up. Technically speaking, all of our providers, we have 10 providers, all 10 of us are experts in hormones, suboptimal thyroid, medical assisted weight loss, and the longevity preventative medicine Cleveland. Like every single one of us can do those things. With specific niche categories, we kind of have what we all like really get excited about. So I do know Fran in our Johnson City clinic is super passionate about women's hormones. She loves it. She eats and breathes this stuff. She's lived with it. She's had pellets for years. She's a queen of estrogen, and she knows everything about it. So if I'm thinking one person off the top of my head, Fran loves women's hormones, and I would absolutely put her in the capital E expert on that. But technically, all of us, I would consider every single provider that we have an expert on hormones for women and for men too, no matter if it's a male treating you or a female treating you. But if you're thinking, I want one and I want one who loves it, Fran eats and breathes this stuff.
That's awesome, Kay. Thank
She's
you so much
awesome.
for that. Yeah.
I say ain't no pellet like a Fran pellet. Fran pellets don't quit. They don't quit.
I love it, Kay. Thank you so much. And also, just if you're kind of diving into that world, Kay, one thing that I feel like I hear this every single day in office is it all about women's hormones? Pamela Smith, is that the title?
Oh, wait, say that
The
again.
book we recommend.
Oh, Pam Smith. Yes.
Pam Smith.
Yes,
all about
absolutely.
women's hormones.
Yeah.
All right, Kay. Hope that helps. We're going to keep going here. I'm going to look for. I know I'm missing a couple, so stay with me here. I promise I'll get to them. Let's get to. Let's get to Connie Lynn. There we go. Connie Lynn's asking, I love the Life Extensions gummies. Is there a powder collagen you recommend?
Keto collagen powder. That's the one my sister uses every day. Flawless skin. She looks like Barbie. No questions. Keto collagen powder. We do have it in the office, I believe. Katie, Carter, do we have it in the office? I think we do. We did at one point. Keto collagen powder is the one that we do.
Connie, we'll be on the lookout
we
there.
call Katie and Carter Google 1 and Google 2.
Yeah. PM Google.
PM Google.
We'll ask the PM Googles. They will get, we do. Okay, so Carter is saying we do. Thank you, Carter, for that. Let's get to, I want to put this up. I saw it. Now I missed it. One, I see Montana's in here on Instagram. Montana.
If you want to laugh, if you want to laugh in the office, Montana will make you laugh.
She's the best.
We played in the sinkhole today. We're having a little bit of trouble in the little part of it, so we played in the sinkhole today. It's fine.
Huge shout out to Montana. Thank you for being with us tonight. Okay, let's get to. I know Roel had another one. Here's one from Linda.
Stephanie's. Look at Stephanie. Sorry. Hey, Stephanie.
Let's get this
Stephanie
one.
Lay.
There we go.
Oh yes,
We gotta
come
get you in
on.
Knoxville.
He's on down the road. Come on, he's on down.
Thank you, Stephanie. Let's get to Linda here. Andy, how can I reset? I think it's reset. Yeah, it's reset the crystals in my ears. She feels off balance.
That's so tough.
This is
I'm
tough.
so sorry, Linda. So too, there's actually maneuvers, and we do have someone in the office that can do that. Ernie, our PT, who just turned 70.
Yep. Huge.
Yes,
Happy birthday, Ernie.
Huge happy birthday to Ernie. We call Ernie the magician. He
He's
is
the
a
best.
magician when it comes to manipulations, to physical therapy, and there's different maneuvers. There's one called an Epley maneuver. An Epley maneuver will help reset its particular mover. You can Google this, Linda. So there are ways to actually do it by yourself. I'd recommend having a trained professional doing it with you, but because you can get off balance and feel very dizzy. And if you're not around somebody who can help you get up, I would honestly recommend doing it with somebody. But there are at-home ways to do the Epley maneuver. So there are crystals in your ear. They're little rocks, canalus are what they're called. And they can just move in the wrong way. They can get hurt. There's little hair cells that work on the rocks that then create and vibrate sound. Our ears are very complicated. Okay.
Man,
Our ears are complicated.
they're complicated.
There's hairs, there's ears, there's cochleas, there's spinny tubes, everything. There's literally a drum. Ben wanted to play the drums as a kid. God help him. So they're complicated. So when the crystals and the rocks get displaced, it can cause vertigo, can cause hearing loss, tinnitus. I never know if it's tinnitus or tinnitus, but ringing in the ear. So Epley maneuver is what you're looking for, Linda. I hate that. But Ernie can help you, or anybody trained with the Epley maneuver.
Linda, thank you so much for sending that in. I hope that helps a little bit. I want to get to Karen one because this is such a great question.
Come on, Karen, bring it on. Bring it on.
And one that, this can get confusing. So thank you, Karen. I'm a big fan of the Dr. Rogers vitamin suggestions and take several. However, I recently purchased the Performance Medicine multivitamin. Not sure if I continue vitamin D, but there's not K in tablet. Continue magnesium, ? So many are in the tablet. Any risks? Also 3 times a day, all at once. Okay with food. So this is one, it's just a great opportunity to talk about kind of this process because she's talking about the super vitamin, and there is a whole bunch of stuff. I might even have a graphic here. It's like There's like a lot.
So
So
put up the graphic. It's right there.
let's see if
You
there.
can you
There you go.
Yeah,
Full
up,
line,
up,
blah,
up,
blah,
up,
blah,
up,
blah.
up,
There
up.
we go.
boom.
Okay, so I'm gonna hide this so you guys can see what's in it. So this is a lot. So this is what's in the super. What Karen is asking, do I continue my vitamin D with K? What can I continue in addition to the super? And this is probably going to be like an ongoing conversation. But what's your thoughts on for Karen here? Let me bring her back up. There we go. And I'll hide this. Okay.
Beautiful. Okay, so yes, you can continue taking that. So you really have to overdo it on vitamin D to become a toxic level. There's very few toxic level cases of vitamin D. Vitamin D is a fat soluble vitamin, so it can become toxic. Vitamin A, D, E, and K, those are these fat soluble vitamins that need fat to be absorbed, but also kind of stay in your system. You don't flush it out very well. So you can have a buildup of it. So can you take it? His vitamin D separately has 5,000 IUs. So you'd be having 10,000 IUs total. So that's not a crazy abnormal dose. It seems like a lot, but what I would do is I would continue the vitamins that you have and then check a level. That's exactly what I would do. I'd say you never want to waste the vitamins. I'd say get in the routine of saying, what does it feel like if I have 10,000 IUs of vitamin D, and see if it gets too high? Levels upwards of 80 to 100 are great. Anything really above 150 is probably a little bit too high. So I would check those. Some people will just do the Dr. Rogers Super, the omega-3 and magnesium. So those three together with the Digest Shield with meals, that's kind of his bundle. That's for everyone. And then you can use vitamin D on top of it. If you're traveling, if you're feeling a little bit under the weather, pop a couple more of the vitamin D and use those separately as needed. So that's typically what I do, is I don't do the vitamin D separately anymore, but I didn't stop it. So I just continue what I had, and then the next bottle I got to use as needed. So the other one with magnesium, continue magnesium. I think that's great. You just want to monitor to make sure you're not having too many bowel movements. We can check an RBC magnesium or a CMP to see if you're too elevated with magnesium. You don't want too much. If you look online with kind of the recommendations, people are looking at anywhere from 350 to 400 milligrams of magnesium. Ours alone carries 500 milligrams of magnesium, or a little bit more. So I'd say too, I don't think it'd be too much to do those. I do a super and a magnesium together, and then D as needed 3 times a day, or all at once, or with food. I think vitamin D definitely needs to be with food. So I would say a super, I would do it with food because you want some sort of fat with it. It will absorb and better in your system. You'll get a better benefit.
It also has, I think it has 30 milligrams of zinc in it as well. The super does.
You'll feel better with food.
You'll feel better with food.
Most people do.
The one thing I stopped when I started taking the super was zinc, actually, because I was taking 50 plus the 30.
It's a lot of zinc.
It's a lot of zinc.
And then 2, you said 3 times a day or all at once. I usually do them all at once because I just do everything at night. It's easier for me to remember, but you absolutely can split it up. That's just more personal preference for you.
Really, the big thing is like compliance. I remember you telling
Compliance
me
is huge.
Like whichever one you're going to know.
I had
you're
that
doing.
question today from a patient of like, she's like, I can't handle all those vitamins at once. It makes me feel like garbage. I was like, hey, let's split it up. If you can do morning and night, then great. And she's going to feel better from it.
Let's get to Jill here. Thank you.
Thank
Karen.
you for being a fan of that.
Yeah,
Karen.
awesome.
We're fans of it too.
Jill is asking help for ulcerative colitis for my 80-year-old dad.
I'm sorry.
Yeah,
UC
sorry,
is awful. UC and Crohn's. So those are going to be, that's not IBS, that's IBD, irritable bowel disease, not syndrome. So the disease comes from autoimmunity. So ulcerative colitis and Crohn's, they're in different parts of the intestines. Crohn's has small and large intestine involvement. Ulcerative colitis is really specific to the large intestines, and can be debilitating. I'm sorry for that for your dad. 2, you want to calm the inflammation. So if you're looking at more natural stuff, there's going to be an autoimmune like nutrition plan from Gundry. A lot of people get UC relief by having very non-inflammatory foods, which is a lectin-free diet. Low dose naltrexone is amazing for this. I know I'm an LDN fan, but especially for gut health, ulcerative colitis, Crohn's, LDN is a no-brainer to try and start and see what a symptom relief looks like and see what repeat colonoscopy looks like. Ulcerative colitis, and when you move up to more prescription levels, you're looking at like, there's one that Pentasa, there's immune modulators and DMARDs. I mean, it's a risk benefit, honestly, of what it depends on what he's on right now for, or if he's seen a GI. I think having a GI specialist is a must because you want to have routine colonoscopies with this. So having a routine GI, LDN, non-inflammatory diet, and anything that's going to calm inflammation and de-stress for him, because that will get him out of flares. I'm sorry for that.
Jill, thank you so much. I hope that helps a little bit. I hope your dad starts to feel a little bit better. Thank you, Carter, for that comment there. It's a great suggestion, along with same with me with the zinc.
That's a great
Carter.
suggestion too. A lot of people just want to split it up, and that's totally fine.
Let's get to Roel here. Roel is asking, when a male or female are on testosterone intramuscularly, can they still raise their own natural testosterone while lifting weights?
Sure.
What about total testosterone?
That's great. That's a great question. Yes. Anything you're doing to stimulate your own testosterone of your brain talking to the rest of your body, yes. With continued use for men, women, it's a little bit different because they already started at such a low level anyways. Normal on a reference range for labs is 2 to 45. So you're really getting low levels anyways. For men, you're starting off with high levels. Your body's going to use the T that you're injecting. So it's going to use it. So it might not use past the threshold. It depends on how much you're lifting. But I think anything to keep your natural T up, sometimes people just use T as like I don't want to say as a crutch, and that's kind of being a little bit judgmental, but like you got to use the T that you have. You'll utilize the T more if you're doing the things that will stimulate T, which is going to be honestly sexual activity, whether it's with somebody else or by yourself. I know that sounds taboo, but I think that's very important for testosterone, for overall well-being, for serotonin and dopaminergic action in the brain, endorphins, oxytocin, and then two, working out, stimulating muscle with lifting weights. Absolutely. Yeah. I think that'll help. There's not a great way to know though via test. You can't really test what is in your natural production versus your total testosterone production. You can test an LH to see a luteinizing hormone is going to come from gonadotropin releasing hormone into the luteinizing hormone, which then stimulates the T. So you can kind of test and see if that's still going. Most often that level seems to be depreciated whenever you're on testosterone for a long time. So, but yes, that never hurts. Continue lifting and can absolutely help.
Let's get this from Roel as well. This is a one because I love this question.
Yeah.
Dr. Rogers mentioned last week that he uses a very low dose of progesterone for sleep. Can this help me with my sleep?
Totally.
Totally.
Absolutely. There's a lot of things that you can do for sleep, and that's one of them. Absolutely.
All right, I want to put this up because I saw it at the beginning, and I want to get to it because it's such a fun question. And here's what I want you to do, Ange. Okay.
Oh, Tom, don't do this to me.
So Tom's favorite one is Wonderful Life and A Christmas Story. Actually owned one of the prototype leg kits. That's awesome.
Fragile.
I love it.
It's an award. It's an award.
One, I want to know what there's still some people with us live. If you guys have a favorite, go ahead and put in the comments. I want to know it.
It's Christmas it's not July, it's August, but it's almost.
But on 3, I want you to tell your favorite.
Top 3 or 1?
Your 1, and I want us to do it at the same time.
Wait, hold on.
Because I don't want you to copy mine.
Hold on. God, that's hard. I have 3.
Let's do 1.
Shoot.
Because this is favorite Christmas movie. All right, 1, 2, 3. A Family
4
Man.
Christmases.
Okay.
Nice. Oh, sorry.
Nice.
4 Christmases. I love 4 Christmases. I would say 4 Christmases, Family Stone, and the Santa Claus.
Family Man's not even on there?
Family Man's a 4.
Number 4. Okay.
I
love. I have a feeling. Tom.
I take it back.
Weightlifter.
So Santa Claus.
You know, Arnold Schwarzenegger was in Jingle All the Way.
Jingle All the Way is top 5.
It's a great one.
Gosh, that's good. Oh, I
so
love Christmas movies. It's a Wonderful Life is so good too. I think both of those are amazing.
Can't go wrong.
2, shout out local. Jonesboro Repertory Theater is doing A Christmas Story, the musical, this December. Do not miss it. JRT is such an amazing theater. They're going to do great stuff. So they're doing A Christmas Story, the musical. You will not want to miss that.
I want to put this up from Lynn K. Lynn. I missed this one. Sorry, Lynn K. Does methylene blue cause dizziness? I'm only taking 15 milligrams per day.
So I've actually had 1 case of this. 1. So 2, it kind of can affect blood pressure if it's too much for the person. Technically on paper, 4 to 8 milligrams is not high. 15 to 30 milligrams is a moderate, like mild dose. So on paper, no. But yes, I've seen it once to where it can increase norepinephrine a little bit, which is a neurotransmitter, which then can affect your blood pressure. So which then it can affect your stability, your dizziness. So I have seen that.
That's interesting.
So if it is, what I would do is test it to see, like, stop it or half it and see if it gets better. If you're experiencing dizziness, play around with it and see if it goes away with it. So I have seen it once. So we were playing around with microdosings of it.
how much is in a tablet of the NeuroPro Pro Plus?
The NeuroPro that we have is 15 milligrams per tablet,
Per
and it is tabbable. You can break it in half.
Interesting.
Yeah.
Okay. Yeah, that's I switched.
But they
to
make
that.
so many, they make so many of them. There's one from that same company that makes like a 4 milligram one with vitamin C. So
Tom, I don't think I can post that. I have no clue how to do it, but I'm seeing it. I'm gonna have to go back in later and see if I can see that picture.
to the shot of the
lamp.
leg lamp. Oh my God. I want to see it.
That's the best.
I love it.
I don't. It's not clickable for me. But what we will do is on the back end, I will go and check that out for sure. I'll have to go in onto Facebook. So thank you so much, Tom. We love you, man.
I'm getting you is it Red Ryder BB gun?
Yeah.
For Christmas, Tom. Okay. Expect it at your door. Do not shoot your eye out.
Guys, I think that does it. If I missed you, I apologize. I do not think I
Time
have.
flies when you're having fun.
Yes, dude.
Time flies, dude.
Thank you for doing this,
Ben, thank you for being a brother. Thank you for being a friend.
guys.
Thank you for being a friend.
How did we do? I'm no. Pause
Yeah,
this.
I'm going to tell you right now, I will not be back on this podcast if I cannot be on the right side. Do you see how this is more my side? I could be doing this. I could give a good profile.
Oh, yeah, that's
but
fine,
sit
that's
here
fine.
with all this. No, this is not my part.
Okay. Well, we'll have
I'm
to.
always on your right. There's
Guy-
no door over there. And ladies and gentlemen.
So we did okay. Karen said we did great. I see
Yes,
Cherry saying we
thank
did
you,
great.
Karen.
Tom saying we're doing awesome. Roel, thank you. You know what? You're gonna have a move Friday. I'm excited for you.
Thank you.
You've been my
Yes,
roommate
yes,
for the
yes.
last couple of months.
Gosh, Ben, there's no better roommate. Well, don't tell Will. I lived with
Yeah.
my friend Will in PA school for 3 years. You're a great roommate too.
He's
okay?
awesome.
I love you.
He's awesome.
But yes, Ben, we've learned so much.
And
we've learned so much.
I want to say real quick. Let's. Okay, Montana. I see you, Montana.
The waffle guy. Yeah.
Okay, let's see.
Tell Bo I'm here.
Montana saying, Bo say, wait, is that who I think?
Waffle
I
guy.
love it.
Tell him yes, and I am, and I'm going to get those Stroop waffles. I am.
I love it. I love it. Huge shout out to Bo. Thank you for being with us tonight. I love it. All right, guys. Carter. Down the streets of Knox once you move out. I can't.
Probably.
Thank you.
Wait, hold on. Where's the desk, Andy? We don't have it yet. Karen, I'm so glad you brought this up. We're moving and shaking in here, okay? We're doing a
Right.
revamp. This is called Project One Runway, Ben's office, okay? Yeah, eyes in or you out. We're gonna make this office amazing.
I love it. Thank you. Thank you, Karen.
My desk is over there though, and y'all would love it. It's inviting. I have a candle.
I love it.
Ben, your office is inviting too. There's a lot of coffee cups on the table.
Karen's saying I need one of her stand-up desks, and I agree with
Yes,
her.
you do.
I agree.
Yes, you do.
I
Karen,
agree.
you know mine's over there. It's the desk. It's the desk.
It's right over there.
Right over there. And yes,
You look so comfortable while you're standing, and then while you're sitting.
standing. I'm doing squats.
Yeah.
It's got pockets.
You know, your
Oh,
in-body
gosh,
scan
you have
looks
the
awesome.
best desks. Those desks are amazing. I think Mom's got one too.
DPC, thank you so much. Thank you so much.
Oh, thanks,
Ivy,
y'all.
I agree with this. Ivy's right. You're smart.
Ivy, you're smart too.
I appreciate
Listen,
that.
we're all smart together. This is collective effort. So y'all, thank you.
Guys, thank you so much. We will be back next week. We do this show every single Tuesday, 7 to 8. We answer all your health and wellness questions. You guys make this show great. Thank y'all for being with us tonight. We love you.
We love you. We love you.
Was that your song? All right, guys, we are out of here. I'm looking for Brad with my outro.
Take it
Brad,
easy.
come on. Come on, Brad. Take it away.
Don't go away.